Good evening. My name is Mari Myers. My class is Public Program Evaluation. My professor is Lawrence Montiel, and the name of my paper is Nonprofit Organization Profile. I'm going to talk about Brockton Family and Community Resources Incorporated, a company that's drowning and trying very hard to stay afloat. They're headed for bankruptcy, and they're a failing human service agency that's been in existence for 90 years. Brockton Family and Community Resources is located on 18 Newton Street in Brockton. It's a charitable organization in Brockton, Mass., and it has been in existence since 1978. Brockton Family and Community Resources provide services to individuals, children, and families who have been exposed or have been victims of violence. Brockton Family Resources Incorporated is over $1 million in debt. They have filed for bankruptcy, and according to the Internal Revenue Service, they have $705,149 in unsecured liabilities. The agency has assets of over $664,000 as they own a building in Brockton. Brockton Family and Community Services is filing bankruptcy because they failed to pay employee taxes for over 2 years. Brockton Family and Community Services receives state funding from agencies like the Department of Public Health, the Department of Social Services, the Office for Victim Assistance, the Bar Association, Brockton Housing Authority, private grants, and some fundraising as well. The attorney for Brockton Family and Community Centers attributes their need for bankruptcy due to the lack of state funding that Massachusetts is giving and the failure to increase it over the past 10 years. Brockton Family and Community Services again serves individuals and families whose lives have been affected by trauma at home, at school, and in the community. They provide high-quality services, which includes advocacy, support, individual and group treatment, case management, community education, and training. Victims have the right to receive these services free of bias with regard to age, gender, race, income, religion, sexual orientation, national origin, physical or mental challenges. All of these services are done privately with confidentiality and dignity. Services help to empower individuals to move toward personal growth, health, and happiness. Services include mental health services, providing a range of behavioral services for children and adults who are survivors of trauma. Domestic violence services, which advocates services to survivors of domestic violence and their children. It includes a 24-hour hotline, referrals, parent groups, and individual support. Child Witness to Violence program, offering support to children 2.5 to 17 years old who have witnessed violence in their home. Family Violence Offender Services, which partners abuse programs certified by the Department of Health. Prevention, education, and outreach programs. Supervised visitation services, which is a place where children can reestablish relationships with a parent. Supervised on-site and off-site visitation programs, and out-of-the-home placement services. In order to fully and effectively determine the needs of the organization and who it serves, it's important to develop a needs assessment. A needs assessment would include speaking to people on the front lines, people who are involved in the action of this program, getting their opinions, understanding where they're at, and gathering information on their experiences and finding out where the need really is. The problem with the information can be subjective and biased, but it's important to find out if the program still needs to be in existence at all. This will give us a scope of understanding if this company needs to continue to exist, and it'll give us a focus when understanding funding sources. The assessment should be done as a mixed delivery system. You need to do observations, do needs assessments, do surveys, and find out all of the aspects of this program, and do questionnaires and things that are going to help you to understand the program, the funding, and where exactly the needs are. Brockton Family and Community Resources is a service agency which serves those who have been exposed or victims of violence, and client confidentiality is an issue. Privacy shall never be compromised. There are established standards to protect medical records and other personal information. In this case, assessors may not have or need to have access to records that involve quality or are used to improve or evaluate the program. Asking specific and personal questions all by itself could be an issue. Using technology can gain data that can be used and helpful when anonymousness is important and necessary. Ethics becomes an issue. Guidelines around asking questions and using data around children need to be established. Folks may not want to answer truthfully to protect the program. Does the program make a difference in the lives of those who live in Brockton? Clients need to be informed. Maybe some way to get consent would be beneficial. In Massachusetts, internet and technology laws require the operator of the website to disclose what the information is used for and requires parent permission and allows parents to collect any personal data collected from a child. Many ethical questions need to be addressed. All evaluations need to be culturally sensitive, making sure that ethnic minorities but those focusing on ethnic minorities take an increased level of care. In Brockton, there's a large Spanish population, and it's important to make sure that we're being culturally sensitive to their language and their culture. There's a possibility that cultural differences that might get in the way of good data or getting the job done right to strengthen the community may be important. Strengthening the program includes strengthening their clients. This program serves people who are at risk for violence and trauma. Brockton is a diverse city. The impressionistic approach would be reasonably inexpensive in allowing a public forum to help everybody understand what's going on with this program. The results of the assessment will help inform a business plan, and the business plan should definitely include doing new fundraising, helping to gather new folks who become stakeholders in the program. So I thank you for listening to my little speech on Brockton Family and Community Services. Thank you and have a good night.